Ready to go. Adaptable communication materials promoting long-acting, reversible contraceptives, or LARCs, as a choice for youth. There are nearly 2 billion youth between ages 10 and 24 living in our world today. 16 million girls between the ages of 15 and 19 give birth annually, and an estimated 33 million young women in low and middle-income countries have unmet contraceptive needs. In response and filling a noted gap, the Health Communication Capacity Collaborative, or HC3, created innovative, adaptable social and behavior change, or SBC, materials to improve youth access to an expanded contraceptive method mix. Specifically, the materials focus on long-acting reversible contraceptive methods, or LARCs. LARCs include the intrauterine device, or IUD, and the implant. While safe, the most effective and even recommended methods for youth, uptake remains low. HC3's materials address 3 main barriers to youth LARC uptake. 1. Bias against youth using LARCs, especially if a woman is unmarried or has not had a child. 2. A lack of complete information on LARCs. And 3. A lack of trust between providers and youth around contraceptive services. HC3's adaptable materials include a short video for providers featuring role model and narrator Maria, a healthcare provider at a community clinic. The video provides 4 simple tips on providing client-centered, youth-friendly contraceptive counseling. Be client-centered, introduce LARCs first, deliver same-day service, and encourage dual protection to protect against pregnancy and HIV and sexually transmitted infections. The video has a supporting discussion guide, which includes pre- and post-tests, role-play exercises, and discussion questions to help providers interactively explore providing quality, LARC-inclusive services to youth. The package also includes a client brochure outlining LARC benefits, key facts, testimonials, and the call to action for youth to talk to a provider to see if a LARC is right for them. Finally, the suite includes a series of 6 visually appealing posters for youth, encouraging them to consider whether an IUD or implant is right for them. Family planning project managers can use these materials to introduce LARCs or increase LARC acceptance among youth and providers, reduce barriers that prevent youth LARC uptake, save time and resources by using ready-to-go materials rather than creating them from scratch, and increase impact of existing family planning projects by using SBC approaches and expanding their scope to include LARCs and youth. These materials are already responding to project managers' needs around the world. At the recording of this presentation, HC3 has received 29 requests from organizations in more than 21 countries to adapt and use the materials, including plans to translate them into Portuguese, French, Spanish, Swahili, Wolof, and other languages. The materials have also been shared on project and organization websites. In Madagascar, Projet Jeune Leader translated the video to Malagasy and used it in health worker trainings to strengthen communication between providers and adolescent clients.
We showed the video during the training and the health providers loved it. And for me and my team, it was an excellent tool that really allowed us to convey our messages in both a creative, fun, but also youthful manner.
In Mozambique, Population Services International, or PSI, translated the poster and brochures to Portuguese and distributed them in 30 clinics and 100 schools. In Guatemala, PSI's affiliate, the Pan American Social Marketing Organization, or PASMO, translated and adapted the poster and brochure into Spanish and distributed them in youth-friendly spaces. The brochures were also used as provider job aids. Finally, the Knowledge for Health project adapted the video's visuals and script as part of the Zika response in Guatemala, the Dominican Republic, El Salvador, and Honduras. They shared all Spanish materials, including the posters and brochures, with public sector providers and International Planned Parenthood Federation member associates at in-person events and through the online Zika communication network. The LARC materials are also available in French on HC3's website. So, are you ready to promote LARCs as an option for youth? Request the materials today or share the links with someone who might. The materials can be downloaded in English or French from HC3's website at healthcomcapacity.org/LARCs. To adapt the materials, simply submit the online request form and HC3 will send you Microsoft Word, MP4, or InDesign files of your selected materials. The request form is available at healthcomcapacity.org/LARC materials request form. These tools were developed under the Health Communication Capacity Collaborative, funded by the United States Agency for International Development and led by the Johns Hopkins Center for Communication Programs. For more information about the project or to view our resource catalog, visit the website at www.healthcomcapacity.org. For additional LARC materials questions, contact Erin Portillo at erin.portillo@jhu.edu.